Bismillahirrahmanirrahim. My sharing story continues. However, before that, friends, if you like my table talk series, please support and click on the subscribe button. If you recall the last time I asked a question to myself to do or not, I wasn't sure then about TKR operation. I consulted many friends, family, professionals before I could decide to say yes or not to do an operation on my knees. We are very privileged today because I managed to get my cousin orthopedic surgeon to talk a little bit about TKR with us. And I would like to introduce him, Dr. Zulraini Johari. He is working with KPJ Johor Specialist Center, and he's been there with an experience of 31 years. Prior to being in Johor Bahru, he was a lecturer at the University Hospital Kuala Lumpur. Okay, over to you, Dr. Zul.
Assalamualaikum. Thank you, Putri Juliani, for having me. You asked me what is TKR. Literally, it stands for total knee replacement. It is actually a resurfacing of your knee joint. What we do, we give a new surface to your knee joint. If you look at your knee joint, it is made up of your thigh bone, the upper end of your leg bone, and your kneecap. And if you look at the end of the long bones, there's this white, smooth tissue which we call cartilage. For many reasons, which I will briefly mention later, this cartilage can get worn off. As you can see here, the cartilage worn off and will expose the raw bone underneath it. When this raw bone rub against each other, especially when you walk, will cause pain. One of the main causes of why this cartilage got worn off is the aging process. Others, if it has got to carry a heavy load, for example, overweight or previous injuries to the knee joint, or damage by some inflammatory process, for example, rheumatoid arthritis, all this leads to wearing off of the cartilage that lines your joint. And this is generally called osteoarthritis. What we do during an operation of TKR is we reshape the surface of your knee joint so that we can fit a prosthesis made of titanium or metal alloy with strong plastic polyethylene in between to mimic the shape and size of your knee joint, as this would prevent the rubbing of the raw bones together. We would relieve you of your pain. Is it a major operation? To me, any operation that takes more than 1 hour is a major operation, especially when it involves your large, long bones. Technically, it is highly demanding and very precise surgery, so we cannot afford to have any mistakes. I will try and answer your 3 questions of benefit, risk, and the best age to do TKR together. There is only one benefit of TKR, that is to reduce your pain. If you feel the pain in your knee joint from the effect of the worn-off cartilage or osteoarthritis is severe enough to affect your normal daily activities, and you have tried or been prescribed all the non-invasive treatment and failed, then you may need a TKR. As we have discussed earlier, it is a major operation, and apart from the general risk of a prolonged anesthesia, you would also have an open wound during the operation, which will entail a slightly higher risk of infection. And especially if you have other comorbidities like diabetes, it will increase the risk slightly higher, even though the total risk of the operation is small. As mentioned, it is a precise surgery, so small errors will not give the most ideal results at the end. We must remember TKR is man made, it is not as adaptive as the original joint which the Almighty bestowed to us. It is designed with one aim in mind: to reduce pain. It may not withstand the abuse and the stresses that one takes for granted when we use our own knees. So, if we stress the usage of our TKR in our activities, we do not know how long it will last because it can break or loosen. That's the reason why when TKR first came out, the operation was done in the older age group or the retirement group because it was thought that the activities of this group will not be too strenuous. Nowadays, we do the procedure in younger group of people if we deem that their activities will not be strenuous because of maybe their general conditions and comorbidities. Yes, TKR is a common surgery nowadays, but you must remember it's a major surgery and it should not be taken lightly, and it must be done by a trained surgeon. Do not expect that you will be able to climb Mount Everest or play tennis after the procedure, though I know there are some advertisements that may show you that it can be done. If you are able to do it, then you are the exception, not the norm. Finally, the common question that I do get quite commonly, especially from the Muslims: can I pray normally? As I said, its main aim and design is for you to be able to walk with minimal pain. Some do get back their full bending of the knee joint, but some may not.
Alhamdulillah, thank you so much, Dr. Zul, for the explanation on TKR. Isn't it good coming from a professional doctor rather than from me? It was very clear what TKR is all about. And remember, I had my doubts and my fears. And the more that I talk to people like Dr. Zul, the more I'm convinced that we can, despite fears, we can always overcome any obstacles. We just have to believe, yakin in that when we allow the courage to guide us more. Our objective in life, actually, my friends, for me especially, is to develop ourselves towards our own personal growth. To make a decision on life matters is very critical. However, bear in mind that whatever we decide, it comes from the mind. And I'm always reminded by the fact that our emotions come from the mind. And the spirit to do something is what gives us the boost or the trigger for the physical self. When we make a decision, my journey continues. Not making a decision is also a decision, but I had to make a decision. Subhanallah. Thank you. After all the explanations and the talks given by so many people involved, I overcame my fear. And it was courage for me to say yes. for TKR. Subhanallah, thank you, friends, for watching. Stay tuned for the next part. Bye bye.